Yeah. Good morning, Chairman Huggins.
Good morning, Ms. Bono. How are you doing, Ms. Bono
I'm doing
Reed?
well, sir.
Has a quorum been established?
Yes, sir. Your full committee is here. I'll take the roll, please, if you'd like.
Yes, please call the roll.
Okay, Mr. Burgess,
Present. Present.
Chairman Huggins,
Huggins here.
Ms. Mood.
Here.
All right, we have a quorum and a full house.
Okay, very good. Motion to adopt the agenda.
I so move.
A second.
Is there a second? Okay. All in favor, aye?
Aye.
Aye.
Aye. Aye. Great. Next item, approval of minutes. Motion to approve the minutes.
So moved.
And I second.
It's been moved in a second. All in favor, aye?
Aye.
Okay, very good. Minutes have been approved. At this time, action item number 4, I'm going to ask Mr. Deschamps to please administer A, B, C, and D.
Yes, sir, Mr. Chair and committee members. First of all, 4A, in your packet, on the executive order, this is under that executive order, state of emergency. When we prepared the packet, the governor had approved another executive order, April 22nd. But also, since we put the packet together, there's been another executive order of a state of emergency that was approved for May 7th, and it's good for another 15 days. So that's the update on the executive order from the state. I know we have, with the mask requirements, we're still following TSA and CDC as far as how it relates to transit. So as far as mask requirements, it's been extended through September 13th, 2021. So that's what we will be following. I know, as you all have heard in the news, different reporting as far as what the state is doing, the mask requirements, or how they've relaxed those, how it relates to education. Also, too, the city of Columbia extended their mask requirement to June 13th, but I also read that they're kind of like not issuing any citations or really enforcing that. So from our standpoint, we're still requiring masks on the transit system. So that's the current update. And also, too, I'm quite sure everybody's aware of what CDC said as far as mask requirements. They feel that people that are fully vaccinated really don't need to wear masks in certain places and locations, but they still are requiring that they wear masks on public transportation. So, and we're following all of those guidelines. And that's my update on A. Any questions there for discussion? If not, we'll move right on to B, update of the common operations from Mr. Bell.
Good morning. Thank you, Leroy. Good morning, Chairman and Ms. Mood, and of course the board. The details for the month, for last month, came out to 381, with foggings at 396, and the interior and exterior cleanings was at 1,221. We continue to go through processes in order to improve the wash rack that we currently have. We have been in discussions, of course, with Leroy and his team on some of the things that we found and some of the repairs that are ongoing at this time in order to continue the improvement of the cleaning of the buses. In addition of that, we are also continuing to evaluate in order to push the envelope on COVID cleaning on the interior of the buses. Dennis Franklin, the operations manager for TCS, is continuing his efforts of working with ZEP which is the vendor that we utilize in order to get the cleaning products. And he's evaluating other transit systems, school bus companies, in order to figure out how we can improve the cleaning of the inside as well as accomplish additional COVID cleaning efforts. So that continues and is ongoing. And so that's the cleaning report.
Any questions for Ms. Bell?
I would just ask if you comment on how things are going now that we are collecting fares and how the drivers are managing that.
With respect, I have not had any negative responses with regards to the fares. I would have to refer back to my staff and Joey McKelvey. And if Joey McKelvey's on the call, maybe he can, of course, elaborate a little bit on some of the reports from operators on collecting the fares. I don't believe he is. He's not? Okay. I would like to be able to come back to you, Ms. Mood. I apologize. But
Sure.
I will...
I was just wondering. That's. Thank you.
Hey, no problem. No problem.
Okay. Any other comments or questions, Ms. Bell? If not, I'll move right on to C, updates on testing and vaccination of employees. We're still encouraging any employees that need to be tested that they continue to do that, and we continue to support that. Also, in your report on C, we were working with Health Force down at Comet Central for doing testing, and if you notice that over the course of time, the average number of testing decreased from 35 per day down to 9. So with that, what we've done with Health Force is they're also issuing the vaccinations. So we've been able to work with them where they are offering testing also for people that walk up and want testing. So they're able to do both, even though their focus started out first was on the vaccination, but they're able to do testing upon request also. And with that, they've also changed their hours. So now we're offering testing and vaccinations Monday through Friday from 8 a.m. to noon, and then from 2 p.m. to 6 p.m. And those are the new hours for doing testing and vaccination down at Comet Central. Like I said, we continue to strongly suggest to our employees to be vaccinated. As far as the Comet administrative staff, we're at 90% there as far as fully vaccinated employees. And I know from the last meeting, Mr. Bill, I didn't know whether you had any additional information about maybe vaccinations with the operators or your staff.
Yes, the TCS staff has been able to accomplish close to 45% of their staff and operators have been vaccinated. They continue to work with those that have not, and at this point, they've also transported, I take that back, that on May 28th, they're scheduled to transport over 58 trips of vaccinations since the last meeting. By May 28th, they will have done that, I apologize. And they have 8 trip schedules that so far that will take place in the next 14 days. So they're moving along with that. There's still folks utilizing the service in order to get vaccinated. But in addition to that, our operating staff from a fixed route standpoint, we passed out over 100 surveys to try and get feedback from operators on their vaccinations. And so a lot of operators don't really want to complete a survey at this point. They're a little bit reluctant to do so, but they have verbally, close to 19 have verbally informed staff that they have been vaccinated, and we're going to continue talking to them over the next few weeks to try and find out if there's more out there that have done so. So the surveys are not getting the results that we're looking for. And again, it is voluntary for them at this point. So It's something that they're choosing to do on their own rather than take advantage of the policy and, of course, the resources for it to be done at this point.
Madam Chair. Madam Chair.
Well, it's a Mr. today, Mr. Burgess, because that Derek's with us, I'm glad to say.
Oh, okay. Sorry about that.
Yes, sir.
My question is, do we have a list of employees, drivers, contractors that haven't been vaccinated? My thinking is we're gonna run into some serious publicity problems if we're requiring the public to get on the bus with a mask and the bus driver is refusing to get vaccinated. Those two don't seem to coincide. So we need to address the vaccine. Since we are making it available to the public, our employees should be first in line, not unless they have some medical or religious objections to the vaccination. So we need to really pay some because at some point we're coming back in the building for these meetings, and if we have to walk around drivers and employees, we have no way of being vaccinated, that's something we just need to prepare for. Ms. Moody,
Mr. Fergus, I do concur. I asked Mr. Deschamps, not only just to get that information, just to find out where we are, especially with our drivers. I think that's the vulnerability there. And whatever we can do, Mr. Bell, I know Ms. Mood, we had spoke about some incentives, and I would like to hear that more than anything else at our next meeting. But I will defer talking a little bit more about that in the chairman's update. But I do concur with Mr. Fergus, and I would like to know what other agencies are doing also, the size of, especially in the Southeast, the size of the comment. And Mr. Deschamps, if you could do that due diligence for us, I would appreciate it.
Okay. Yes, sir.
I'll just comment that I too appreciate Mr. Fergus's concern and would feel a lot better when we know that everybody is vaccinated. But I understand what Mr. Deschamps is saying. I mean, we have the backup to require masks because of the federal rules, and we accept federal funds, and so the TSA coverage for that and CDC coverage for that, I think we have the support in policy that we need to continue that. We don't have the same kind of authority in terms of requiring vaccinations, and we've not yet seen public policy that pushes toward that. I mean, even though it's been common public health policy for years, for example, that children had to have certain vaccinations to go to school, and we have to have certain vaccinations to travel to other countries. So we've got lots of precedent for it, but as I understand it, we don't yet have the authority to back up a requirement by the comment for vaccination of staff.
And this is Leroy again, and that's pretty consistent, not over just the transit industry, but throughout the employment industry or HR, which as you start to get into these areas, it really gets pretty dicey. And my thing is, I can also, this is something that as we go forward with, and I will look at other agencies and see what they're doing, but this is something to me that we would need to be more led and guided by legal, really, as we get into these areas, because it's a challenge for the whole human resource society. As I look at a lot of their writings and everything, as far as can employees mandate that their employees get vaccinated, and That's how I would like to approach it. So, I'll also, be reaching out and get legal advice and direction also.
Okay, so what we're hearing here is Mr. Fergus wants to get some numbers on actually where we are, and then also we want to look at the possibilities of what's going on in other agencies, and then we're going to ask legal for their guidance. But also, Ms. Bono Reed, part of this is just making sure that we can articulate in all fronts what the common is doing and why we're doing it, and we have the stature of legal and presidents of other agencies also. So, and just be ready to, when that question does come up from the public, we are very well articulated. We're very well articulated on all fronts. Thank you.
Yes, sir.
I will tell you just a piece of information I learned this morning. I was volunteering at an early clinic doing vaccinations, and the nurse I was working with was telling me that where she was providing vaccinations for another employer earlier this week, she learned that employer was offering incentives to the staff of 2 hours paid leave to come and get their vaccinations, and if they complete the vaccinations, a day of paid leave. So I thought that was an interesting approach to take with and of course,
Ms. Mood, you went in and out. Would you mind just repeating the last part of that?
That what the nurse I was volunteering with this morning was telling me that at an employer sponsored clinic that's where she was providing vaccinations earlier this week, that the employer was offering incentives to the staff to come to be vaccinated, and as I think I'm right remembering this, that if they came to get their first shot, they got 2 hours of paid leave. And if they complete the series, they get a day of paid leave. So I just thought that was an interesting carrot, not stick approach to trying to get their employee base fully vaccinated.
Okay.
Very good. Mr. Deschamps.
Okay, if there's no other questions or comments, we'll move on to D, an update on vaccinations and impact to the public. Pamela Bono Reed.
Thank you, Mr. Deschamps. In your packet, members of the committee, I have an update of the Don't Miss Your Shot campaign and the footage and media hits we've gotten when Chairman Huggins went and got his vaccine. It's also in the newsletter that's going out and distributed by Thomas Media Group, as well as the comments through our listservs. We also are pulling some of the footage to go into the commercials that will start up again in the July-August timeframe, where we will be using that. Chairman Huggins, you were on our social media page this week as well, encouraging people to get their vaccines. I'd like to also bring your attention to the partnership discussions with Uber and Lyft, and I'm happy to be able to let you know that we will be offering free rides up to $15 each way for people who want to get their vaccinations, and this would really help the people in the rural areas where, transportation is an issue. And that will be starting on May 17th, Monday, and there will be a press release that goes out on Monday morning about the partnership that the Comet has with Uber, Lyft, and the United Way of the Midlands. I know that Mr. Fergus, you mentioned Mayor Robinson having a request for us to accommodate a vaccine clinic on Saturday, May 15th. And we were prepared to do that through the Uber and Lyft partnership. However, I did get a call from Mayor Robinson saying that they would not be doing the clinic this Saturday. However, I'm going to make sure that we have materials, flyers that could be passed out in the Lower Richland community for people wanting to take advantage of this particular program. The last things I have to talk about are the brochure and the website updates. Since there have been many moving parts, I believe that we've gotten to a point where we can be evergreen with our information. And the new brochure should be going to print midweek next week at the latest. And we received media coverage from WLTX on opening day with interviews and numerous media hits about us having vaccines at Comment Central. That concludes my report.
Mr. Chair.
Ms. Reed, Ms. Bonner Reed, do you know why it was canceled down in Lower Richland?
From what Mayor Robinson was telling me was that they thought that they were going to have a clinic, but it was something else that they were having. It was an HIV clinic and not a COVID clinic.
Okay. Well, I would like for you just to reach out to her and all our rural areas of the county, just to see what the possibilities are with Miss Aiken's healthcare agency to be able to roll out and go up to the public where they're located and use Uber or Lyft when we can. So, okay, Mr. Fergus, you want to add anything?
Yes, I just want to commend Ms. Reed on that effort. And, you know, with our observation, the two young ladies that were doing it were very, how would I want to say, they seemed to be ambitious and were into doing the shots, because they told me even during their little 2-hour lunch break, they just sat in the car. So really it was no lunch break. And while we were there was several cars driving up. So I want to just say, you know, commend Ms. Reed for that effort and putting that together.
Yes, they were very accommodating, and you could tell that they wanted to be there. They welcomed the point of vaccination and made me want to get another vaccination because they were just that bubbly. And I must commend, and I want to make sure that Ms. Reed that we get a letter out to Ms. Aiken and commending her staff, and not only on administering the vaccination, but also making people feel welcome and comfortable while receiving that vaccination.
Yes, sir. I will do that, and thank you. I also want to mention that I did get a report late yesterday on our first week at Comment Central with the vaccines. They have administered 120 vaccines in the first week with, I want to say 12 testings. Was it around 12, Leroy? And 12 testings.
Okay, excellent. Okay, so Mr. Deschamps, I believe Ms. Reed that concludes our report, and that comes up. I believe I'm next, correct?
You're correct, sir.
Okay, sir. All right. So I've spoken with Ms. Mood and Mr. Fergus on how this committee is serving the comment. This ad hoc committee is serving the comment and serving the board, and we're at the point now where it's basically information and making sure that everyone knows all the things that we have available to make sure the vaccination is not only administered, but also making sure that people have access. And I'm going to allow Ms. Mood and Mr. Fergus to talk, but I think the frequency of the meeting every 2 weeks, I think we can cut it down to once a month right now. And it doesn't say this it's something that is going to remain once a month. But at this point, I feel that we just need to inform and talk about all the things that we're doing and the successes we've had, and make sure that we don't drop the ball, but continue to administer across the counties what we're doing. Miss Mood, did you want to add to that?
Well, I would just say that I concur that in terms of regularly scheduled meetings, that I'd be comfortable with our doing that on a monthly basis. I think that the beauty of an ad hoc committee is that we are available, and anytime the staff comes up with a question about COVID or a situation or a problem or a policy need in between, that we are that we'd always be available to be called, and doing it on this kind of call basis makes that easy for us to be responsive to them. So regularly scheduled monthly meetings as needed in between, that sounds good to me.
Mr. Fergus?
In total agreement, but I would like to add one thing. Maybe in Mr. Bell's report to the board, that he give us how many employees have been vaccinated and how many haven't, rather than that percentage. And that can be an ongoing part of his report. So at least we're
Okay.
up to date on what we're doing.
And Mr. Bell, I concur with Mr. Fergus, and also Ms. Mood made some good points on, we're not trying to break the bank or anything, but I do think there's some incentives that are out there for employees to want to get the vaccination and the importance of it. So if you would look at other agencies, transit agencies, some of the things that they're doing. I just heard on the news where someone, one of the mayors or administrators of a county was giving away, or state was giving away a prize of $1 million to 5 individuals across the state for a lottery, just to show the importance of the vaccination. I'm not trying to get to that point, but I do
I was
think
gonna say that sounds good.
whether it's we can just be creative. I'm not trying to break the bank, like I say, but the whole thing is to incentivize our employees. And if we can incentivize our employees, that means we'll incentivize their families, and we just can get further down the road. So,
in that vein, Mr. Huggins, I'll tell you that another employer that I'm familiar with, one thing they did is that at a point they had every employee, after offering the vaccine, they had every employee who had completed both of the shots required, or the one shot of the Johnson & Johnson that's required, that their names went into a drawing for a flat screen TV. So, I mean,
Mm-hmm.
I think there are employers who are being very creative in terms of trying to appeal to people to do the right thing and giving them one more good reason to do it.
And with Ms. Bono Reed's ability to raise these types of gifts, I'm sure she's done it in her past life. That it may be a situation where I'm not trying to put anything else on Ms. Bono Reed's plate, but it may be just a simple situation of asking some local vendors what kind of swag they may have to offer. So, with that being said, any other questions for this committee or for the staff members? Is there a motion to adjourn?
Mr. Chair, I do have a question for clarification.
Mm-hmm.
If we are going to one COVID meeting per month, does that mean it's effective after the next meeting, so that it occurs on the same week as the board meeting, and not on the same week as the Finance and Service Committee meetings?
Well, I mean, why would it need to change the same week of the board meeting?
Well, it's usually the same week as the board meeting.
Okay. Well, we had this meeting on the 14th. So the board meeting is at the end of the month, correct?
Yes.
Okay. I like it. I mean, we have several issues that came up in this meeting, and I would hate to be in a situation where we have to jump through hoops in a couple of days to make the board meeting. So I want to give Mr. Bell and Mr. Deschamps and you opportunity just to, if we have a request and we feel a request for the board is, or certain questions for the board need to be answered, it'll give you guys ample time to get that information out. So I like the mid-month. Board members, do you have a problem with mid-month meeting?
Well, no, because usually this falls on the same week as the committee meetings.
Right.
And kind of have all the committee meetings one week. So this, I agree with you that midway between the board meetings is a nice, I like that.
Mr. Fergus?
I agree. Yes, I agree.
Okay, very good. All right, Ms. Bono, you have any other questions?
So that means that the next.
Mr. Chair, one other thing. Are we getting this information into the panorama, which comes out on a Thursday? And I noticed with this change, were they able to get this 8 to 6 change in the panorama?
You talking about the hours, that we're testing down there?
The hours of testing and vaccinations.
No, sir, we just got this from them, yesterday. It hadn't even been 24 hours yet.
Yeah, I'll send
But
out
we can
something.
make sure that it gets in the next one. Yeah, we just got this yesterday at about 11:30 a.m.
Oh,
And-
okay. Because
Mr. Fergus?
that one does have a circulation around the Eastover Hopkins area. You know, it's a free paper. So we
Yes, sir.
probably need it. Yes.
Yes, sir, Mr. Fergus, what I'm planning to do is take out a small ad.
Very good.
With the Times, and at Comet Central.
Very good.
Okay, so to answer your question, Ms. Bonareed, is that we want to have our meetings the same week as the service and our finance committee meetings, okay?
Okay, so the next one is next month, Mr. Chair?
June 11th.
June 11th?
Yes.
Okay. All right, thank you.
Is there a motion to adjourn?
I so move.
Is there a second?
I second.
All in favor, aye?
Aye.
Have a great weekend, everyone.
Okay.